Hi, I'm Dr. Glynis Ablon. I'm a board-certified dermatologist, and I run the Ablon Skin Institute in Manhattan Beach, California. I'm also an associate clinical professor at UCLA. This presentation discusses the results of a multicenter study that is a randomized, placebo-controlled trial for the efficacy and safety of nutraceuticals for promoting hair growth in men with thinning hair, done by myself, Dr. Ablon, Ablon Skin Institute, and also my co-authors listed here. According to the American Hair Loss Association, hair loss and thinning affects two-thirds actually of men by age 35 and can significantly impact an individual's quality of life. And while treatment options have been increased over the recent years, data on supplement efficacy remains scarce. A standardized nutraceutical targeting men's key underlying drivers of hair thinning, such as DHT, stress, oxidative stress, nutrition, and metabolism, was evaluated in the study. And here we present the results on the efficacy of the hair growth nutraceutical compared to placebo in men with thinning hair. The study population included 112 healthy male subjects between the ages of 21 and 61 years of age who were classified as type 2 through 4 for hair thinning on the Norwood-Hamilton scale. The population was randomized at baseline 2-to-1 fashion for subjects to receive either the nutraceutical or placebo. And the study was conducted over the course of 6 months with clinic visits done baseline, day 90, and day 180. Each clinic visit included standardized global photography, as well as the blinded investigator global assessments of hair growth and quality, the men's hair growth questionnaire, Arizona sexual experiences scale, documentation of adverse events, and compliance counts. In between, a phone call was done to document adverse events and compliance. Results from the blinded global investigator assessment showed significant improvement in hair growth quality and hair growth. The first graph in the upper left shows the actual changes in growth assessed by the blinded investigators at day 180. And we can see that the active group in blue had significantly more subjects rated as improved than the placebo group shown in gray. There were also a strong trend for more subjects in the placebo group rated as no change or worsened over time. And to the right of the graph is actually the same data in a tabular form, indicating the percent of subjects rated as improved, no change, or worsened at day 90 and day 180. Highlighted in green shows that the percent of subjects rated as improved was significantly greater compared to placebo at the same time point, as well as compared to the day 90 in the active group, indicating a progressive increase over time. The bottom graph, and table, showed the changes in quality assessed by the blinded investigator at day 180, and we can see that in the percent of subjects rated as improved in the active group was significantly greater than the placebo group. Here again, there's a strong trend that the placebo group in gray had more subjects rated as no change or worsened than the active group. And to the right, we see the data as a table form with the active group significantly higher than the placebo by day 180. The Male Hair Growth Questionnaire is a validated questionnaire used to assess changes in hair growth as a result of an intervention. It's based on answering 7 questions about the change in the hair since the beginning of the study. This was given to all subjects and the responses were documented. And the graphs here show the difference between the positive and negative responses of the subjects in the active, or blue bars, and the subjects in the placebo, or gray bars. A positive bar means that more subjects reported positive results compared to the negative responses. A negative facing bar indicates more subjects reported negative responses than positive. And overall within the groups, we can see that for the active group, more positive than negative responses were recorded for all questions. This was not true in the placebo group, where more negative responses than positive were recorded in 3 of the 7 questions. When comparing between the active and placebos, there were more positive responses in the active group compared to the placebo group for all questions. And there were also more negative responses in the placebo group than the active group. 3 questions regarding the coverage were significantly different between the groups. Question 1, since the start of the study, I can see my bald spot getting smaller. There was actually more significantly negative responses in the placebo compared to the active group. Question 4, since the start of the study, how effective do you think the treatment has been in slowing down your hair loss? Significantly more of the active group agreed and significantly more of the placebo group disagreed compared to each other. Question 5B, compared to the beginning of the study, which statement best describes your satisfaction with the appearance of the hair on the top of your head? Significantly more satisfied responses in the active group compared to the placebo. And these results corroborate the results of blinded investigator ratings showing overall improvement in the active group and some progression of hair thinning in the placebo group. Here are subjects from varying Norwood-Hamilton classifications and their improvements over the course of the study, suggesting that the nutraceutical is appropriate for men with varying degrees of hair thinning. The first three subjects from the left show improvement after 6 months of taking the nutraceutical, where the final subject on the right is the placebo, shows overall progression of hair thinning. The Norwood-Hamilton is a 2 in the first subject, a 3 in the second subject, both ages 55, a 4 Norwood-Hamilton scale, also 55, and the placebo, which was a patient that was 48 years old, and Norwood-Hamilton of 4. Overall, the nutraceutical was well tolerated, and results from the Arizona Sexual Experiences Scale showed no trends in either treatment group for increased or decreased sexual dysfunction. As far as safety, only one subject from each treatment group was discontinued due to gastrointestinal upset, and all other adverse events resolved without intervention. There were no serious AEs throughout the study. So in conclusion, there was a statistically significant improvement in the blinded investigator assessment for hair growth and quality compared to placebo. A statistically significant improvement in validated men's hair growth questionnaire compared to placebo, and no changes in sexual function, and the nutraceutical was well tolerated. This Nutrafol's men's study support the efficacy and safety, and thank you for your time and listening.